Hi, my name is Aaron Shaw. I'm an occupational therapist and a certified hand therapist at MoveMend. What I want to talk about today is arthritis at the base of the thumb. And that is when this joint at the base of the thumb becomes arthritic, very painful. What happens is that through a lifetime of pinching and picking things up, that joint can wear down and become really painful and really limit day-to-day activities that may seem simple. Something as simple as picking up a piece of paper or a magazine can be pretty painful. And that's because every time you pinch, every time you use your fingers to pinch against something, that load gets transferred right through a pretty small joint at the base of the thumb. But as occupational therapists and certified hand therapists, what we do is teach people ways to preserve their joints. And in cases where there's arthritis in the hand, we teach people adaptive ways to do things. So for example, probably a simple example would be picking up a little box. So you see the way I'm holding this box right now that my thumb actually has to do quite a bit of work. So all the force of my thumb, which is counteracting the force of all my fingers, all that force gets transmitted to the base of this joint, and over time, days, weeks, months, years, and decades, this joint can wear out. So we teach adaptive ways of doing things. So in this case, picking up a box from the underside is less stress on the thumb. Picking up a box or any item with two hands, and now you've cut that force across the thumb by 50%. So we're big advocates of teaching people adaptive ways to do things as opposed to telling people not to do things. One other way to preserve the life of your joint and to decrease pain is to wear a brace across for your thumb. My favorite brace is this neoprene brace by a company called Comfort Cool, and it's called a hand-based thumb Spica. It's neoprene, it's flexible, but as you can see, there's a strap that actually goes right across the base of that joint. So it gives some external support to that joint to decrease pain and decrease the wear and tear. So in combination with adaptive techniques on doing day-to-day activity and splinting, oftentimes people can function doing regular daily activities and not really have pain. In addition to this neoprene brace, we also make custom braces because in some cases, either because of a high demand for the hands or because the pain is so significant, we need to make a custom-made thermoplastic brace. And these are a little bit more supportive than this, less flexible, but give a little bit more support to the joint. And oftentimes we'll end up giving people both. So when there's heavy hand use, you can use a really supportive brace, and then something a little bit softer but still supportive in other periods of time. Most importantly, adapting the way you do things. So if you have pain at the base of your thumb, or if you've been given the diagnosis with arthritis in your thumb or your hand, please give us a call. Those of us here at MoveMend, occupational therapists and hand therapists, we specialize in treating that, and we'd be happy to take a look at you. You can give us a call at 206-641-7733, or you can schedule an appointment online at movemend.info. Thanks.